Well, hello everyone. My name is Monish Rajpal. I'm the Global MedTech Practice Lead for LEK, and I'm really excited to moderate this panel on AI and diagnostics. The diagnostics and imaging landscape is obviously a natural target-rich environment for AI, and it seems like new applications are emerging pretty much every day across the imaging diagnostic space, and every specialty, every department. The space is as fluid as it's promising, but it's also fraught with some challenges and pitfalls. Really excited to talk here today to a panel that is really well positioned to talk about not just the opportunities, but some of those challenges and pitfalls as well. So please join me in welcoming Rich, Taha, and Sonal. Rich is the CEO and chairman of Fujifilm Sonosite. He leads all aspects of the global business. Joined the company in 2017, so 6 years. Previously, he served with Philips across the street from his current offices. Dr. Taha Kasshout is GE Healthcare's inaugural CTO. He leads engineering, technology, and research across imaging, ultrasound, patient care solutions, pharmaceutical diagnostics business, digital health, machine learning, and more. It's a very impressive resume. And previous to GE Healthcare, he was VP for Machine Learning and CMO at Amazon and a CHIO at FDA, Director of Information Systems and Informatics at CDC. Very, very impressive. And Sonal Patel is VP of Corp Dev and Strategy at Hologic. She's responsible for defining and executing the company's inorganic BD efforts, 20 years of experience in medtech, including both Hologic and before that Johnson & Johnson. So that's the experience set that we're going to be drawing on as part of this conversation. So with that, let's go ahead and dive in. And obviously, unless somebody's been living under a rock, you've heard of AI and diagnostics, and it seems like there has been an explosion in how much we're hearing about it. Let's start by talking about why are we witnessing this big bang event for diagnostics and imaging right now? What's driving that, in your opinion? Rich, let's start with you.
Thanks, and thanks for having me on the panel. If you take a look at what's driving the Big Bang, I think it's kind of the perfect time where there's an extreme need for assistance in diagnosing, married with the fact that the technology is getting there. And even if we take it one step further and start taking a look at the healthcare environment that we're in, the staff shortage, staff being asked to do more with less. We're seeing the Kaiser strike because of the amount of work we're putting on staff. And so as an industry, what can we do to help do that? In point-of-care ultrasound, what we're of course evaluating is how do we treat more patients and how do we open it up so that more caregivers are able to be less intimidated by ultrasound. Ultrasound, we all know, can do incredible things. It's also quite difficult to learn. So bringing advanced AI to allow more users to do more confidently, I think it's going to be incredible. So I think of course, we'll talk more about challenges. There are plenty of challenges, but the reason why we're seeing this is it's just the perfect time. And I think that the assets that are available with the need are driving it.
So resources and need coming together. So I know you're pretty focused on that, but also kind of broader societal factors. Would love to hear your comments.
Yeah, sure. I think you're right. We are sort of in this moment of transformational focus on AI in 2023. Truth be told, I do think some of that in the headlines is driven by generative AI, but I do think that that's had a halo effect back into some of the more machine learning, pattern recognition, insight-driven analytics that we see in the med tech industry, as well as intelligent automation. So we sort of are getting this resurgence of attention on the topic. I think one of the things to consider is, you use the word Big Bang. It's interesting, I think from a development standpoint, the industry has really been more like a steady step forward than a big bang. If you think about the innovation that we've seen, at least on the imaging side, really related to image quality, then kind of moving into data science and really digitization of images from 2D to 3D, and then translating that forward to workflow improvements and now AI-enabled insights. A lot of this has been a steady march on the development side. So if you think about what we're doing as an industry from a supply standpoint, it really hasn't been a big bang. Yeah. But the reason why it's kind of coming to a forefront in conversation is I think from the demand side, we sort of hit this cross-section of experience, right? So maybe in the past, we knew AI was going to have an impact, but there was a little bit of resistance. How is this all going to work out? And I think a couple of things are happening. Obviously, the buzz about generative AI is creating interest, but also, I think more importantly, the pandemic in particular was such a transformative event for society. And so now that we're past the global pandemic, we sort of snapped back, but it didn't snap back in the same way. And so as a result of that, people are looking for different ways to interact with one another. The workflow is different, the challenges are different. And I agree, the labor shortage issue and kind of navigating all of that from a staffing perspective is leaving our customers more open to solutions than they have been in the past.
Thank you. Taha, I know you've spent a lot of time looking at data and machine language. Anything from that side that you'd add to the answers is contributing to what feels like a big bang, even if to Sona's point it's been a gradual build-up?
Yeah, I mean, I echo all the prior colleagues' comments here. I mean, in addition, two areas we've been at introducing machine learning and AI in our fleet for the last decade. I mean, it's not, and working from the same use cases, same problem, customer problems. I mean, shortages is one big challenge. How do you stretch or scale already stretched professionals from technicians to radiologists to clinicians? Imagine the patient experience, how horrible it is now where you have to wait for scans or repeated scans. So we've been investing a lot, making material investment. Right now we're the leaders in the number of AIs FDA approved in the market, but the utility of that is bringing a lot of delight to customers. How can you do better scans faster and get better clarity and better resolution on the images, so that way you're optimizing on your cost, but you can also scale your staff and scale your equipment. Command center is another great example about how can you really look at your capacity across the hospital. We saw that during COVID. I mean, how do you really allocate the right patient to the right bed and be able to optimize the workforce? And that continue to have that trail effect even post pandemic. But a bigger issue also is with access to care. I mean, right now around the world, half of the world population don't have any access to care. So a lot of this next generation of AI, the AI has a lot of flavor, from deep learning to machine learning to deep learning, and now with these large models, meaning it could be generative AI, it could be foundation models. These are really amazing tools that are almost self-supervised to go and figure out how to solve that big data problems. And if you look at the last decade of digitization that happened in healthcare, we went from something like about 10-15% of your records were digital. Now all your records are digital. So you imagine now a doctor or a clinician trying to make a sense of the data, where they're swimming in an ocean of highly unstructured data, where almost 97% of that data goes unused because it's unstructured. These next generation of machine learning, like large models, are really amazing at dealing with unstructured data that's collected longitudinally, whether that's medical imaging, notes, lab reports, and help connect a lot more dots, so that way you can make better decision at the point of care. And that's what you see a lot of excitement right now, is how can you really start pulling all these use cases together.
Yeah, no, those are great points. And you brought up data and compute power, and Rich, I think you mentioned it as well. It really sounds like it takes a bit of an ecosystem to coalesce at the right time. That's kind of where we seem to be. I think each of you started to touch on some of the applications where you've seen AI start to have an impact, things that each of your organizations is working on. Maybe just spend a couple of minutes talking about, especially exciting applications that you want the audience to hear about. And how do you choose where your organizations focus from an AI perspective. So maybe just spend a couple of minutes talking about that, and let's go in reverse order this time. So Taha, let's start
I'll
with
start.
you.
I mean, three areas I can mention, or three examples. And one of them is Air Recon DL. This is think of it as an upgrade to an existing system, where we deliver the upgrade as a software. So, and this software is AI based. So, during the pandemic, where you can look at your fleet of MR and run the same MRs, where you can have the scans in half of the time, get 3 times clarity, and double the resolution. I mean, customers absolutely love it. It's one of the most lovable products out there. And with that, translate into now return on investment for healthcare, but also about better patient satisfaction. Now you're scanning a lot quicker, especially have people with neurodegenerative diseases like Alzheimer's patients that can't tolerate sitting in an MR for a long time, or be able to now scan more people in the same period of time, twice as much or 3 times as much. The other area is around oncology. I mean, 2/3 of cancer patients, they undergo some sort of radiotherapy. And the challenge therefore in the treatment plan is you spend hours, sometimes days, ahead of the treatment, is be able to delineate the organs that you should not touch. So this is where we introduced the CT auto segmentation, where literally a click of a button, the algorithm within 10 to 15 minutes delineate all the organs at high fidelity, and be able then the radiotherapist to be able then to just kind of edit that quickly. So you can imagine now the scale and efficiency in the workflow. I talked earlier also about access to care in the global population. Recently, we received a grant from the Bill and Melinda Bill Gates and Melinda Foundation to scale access in communities with advanced diagnostics, with literally a handheld ultrasound, that a non-skilled staff can be out in communities for maternal and fetal health, and this is where we have augmented machine learning in the ultrasound, that you don't need sonographers in the field. Yeah. So you can really scan, I mean, anywhere from doing a full heart scan and doing all the measurements, where you have a central team of sonographers now can really stretch and extend their capabilities. So you can imagine about now bringing that capabilities into rural areas, far reach areas, and truly start closing gaps in care.
It's a great set of applications, and maybe once we go through the rest of the answers, would love to hear which of those are being monetized as well. But Sonal, over to you.
Sure. So AI has been integral to Hologic's strategy, first in breast screening. So we're leaders in breast screening technology with mammography. And so we've had that integrated for a while. And I think one of the unique things that we've seen here is having a radiologist, but augmented through AI, has actually statistically been able to show, the greater ability to catch cancers earlier. And as we all know, as working in the field, the earlier that you're able to catch cancers, the better outcome ultimately for the patient. So, this is a great situation where it's not just technology, but it's technology to a very specific outcome that's going to benefit everybody, including the physician as well. So all stakeholders sort of win through some of these technological solutions. I'd echo the point that Taha made, I think, related to access, because I think we can get sort of the developed world from here to here, just, incrementally better. But I think the bigger challenge in front of us is really around access, and that's one of the most exciting things that I think AI can do, because we've talked a little bit about labor shortages, pandemic driven, but even before the pandemic, we really did have a little bit of a supply issue globally related to skilled mammographers, for example. And then we've recently actually, the second use case I think for us has really been around our CE marked digital pathology product with our ThinPrep product line. So that's kind of translating, pattern recognition. And if you can think about what we have in the U.S. with, very highly skilled mammographers and pathologists, that doesn't exist in every country of the world. And even within the U.S., that doesn't exist in every county of the country. And so being able to translate, high quality, high, efficacy solutions to broader swaths of the population, I think is what's really going to open up the true value of AI. Of course, we all will go try to get something from 98% to 99%, but it's really about this bigger play, and I think that's where the fundamental change will be.
So democratizing access to high quality care at scale that we cannot
Correct.
do.
Yep.
That's great. Rich, your thoughts?
Yeah, I'll take a stab at maybe instead of diving into products, maybe the process that we use in the lens we take a look at for AI. And as we take a look, almost by definition, point-of-care ultrasound is used by people who are not trained on ultrasound. So these are not sonographers, echocardiographers. These are people who are looking for an answer at the bedside, or they're looking for a precise needle placement. So it's actually a really fun process saying what are the procedures that are done where we believe AI can make the greatest impact. A lot of times companies or different groups or consulting organizations even can try to figure out, it used to be the triple aim, now it's the quadruple aim. And that's how do you increase access to care? How do you treat patients better? How do you do it at a lower cost while taking care of the caregiver? I think if we look at, as an industry, that if we look through that lens of the prioritization of what we do in AI, we're going to be very successful. That's how we do it. I think there's some really exciting developments very close for us, as well as it sounds like across this panel. So,
Thank you, Rich. Tahan, I know when we talked about some of these exciting applications and how you think about prioritizing which ones you're going to focus on, you talked about your NPI Vitality Index. Maybe tell us a little bit about how do you pick of the thousands of things that you could apply AI to in your business, where you choose to go, and how much of that do you do?
Yeah, we have sort of a hybrid approach how we look at investment in general. So R&D is definitely, we are committed to R&D. It's evident in our MPI Vitality. MPIs, you look at the percent of order across new products, say, in our case, in the last 12 months. So in 2022, that was around close to 30%, which is really amazing. Our medtech, anything above 20% is really great. So, but that's just one mechanism. But we're looking at also other areas, agile development, not just in the software, but also in the hardware. Looking partnerships, such as recently we with the Mayo Clinic around advances in theranostics, Alzheimer's disease, how we can look more holistically about advancing care from quality to diagnostics to monitoring to treatments, and push the envelope way beyond diagnostics, including bringing AI. The other areas, as I mentioned earlier, is also look at different models. The model I mentioned with the software upgrades that really bring a lot of delighting components to customers and software upgrades to existing hardware. Imagine you have a fleet of MRs and you're not ready to upgrade those to the new machines. Now you can still realize high ROI while still getting better pictures and images and scans and standardized the process at the same cost with these software upgrades. So that's a net new business model for us, and it's been a winning model for us in introducing more machine learning models like this. We have similar aspects in CT and ultrasound and even in monitoring. And when it comes to these large foundation models and cloud is a big component. It's going to be in processing and bring in access to these software as a service, whatnot. So this is where also different kind of partnership with big tech is also on the horizon for us, where we're doubling down on that. So we're looking across the board. We have a mechanism called worldwide product planning that really sort of standardize the process across all our businesses, standardize on the MPI as well, the ROI, so that way we have a good view where we need to invest while we keep the patient and providers at the center about how we're advancing care significantly from year over year.
Thank you. I do want to make sure we have enough time to talk about challenges, but Rich, Sonal, anything you want to add in terms of how, and Rich, I know you already touched on this a bit, but anything you want to add in terms of how your organizations pick where to focus for AI development? Very quick answers on this.
I'll give a quick one. I think the big challenge for a lot of us when it comes to AI is the whole make versus buy question of, do we want to try to learn this? And I can tell you there are challenges, especially if you take a look at point-of-care ultrasound, you need to make sure you have the right hardware, the right internal power. The algorithms have to be light so that they can give you real-time, light and effective, to give real-time answers. So there's a lot of challenges, but there's also some great, almost off-the-shelf capabilities. There's a lot of AI companies out there that have solutions. And then there's, going through it internally and learning through that process. And we'll get to the challenges later, but we've discovered a lot. But we're all going through the learning. I think the make versus the buy is always one of the most challenging questions.
That's a great point. So, anything to add, or should we jump forward?
No, just very quickly, I think make versus buy, internal, external. I think the one thing that's been great is once you sort of get a foundation of technical expertise internally, it actually is kind of nice and a little bit easier to translate that to a second application. So taking that from breast cancer screening into cervical cancer screening, we're able to do a lot of that work in-house because of that capability internally. So I think that's only going to continue to grow.
Thank you. I know the next topic is near and dear to each of your hearts, and an important one for us as an industry to grapple with. But we've talked about opportunities, but there are real challenges, some lessons learned, and these questions around what is the right way to think about responsible AI. So maybe let's spend a few minutes kind of debating and discussing how you think about that. And maybe let's go Rich, Sonal, and Taha.
Yeah, I mean, there are challenges. Everything from how do we do this, and get populations and images that are representative, not only of the United States, but on a global basis to ensure health equity. How do we go through this process and ensure that we're actually the AI is going to help and be more reliable than the caregiver is now. So that, going through the process, of course, we've been working closely, as everybody has, with the regulatory environment, but healthcare, the regulatory environment's learning as we're all learning right now. So that's another challenge, getting through that, and then I've mentioned earlier, just making sure this that it will be effective and impactful on our systems. And I think that those are all elements of challenges. And I think what's interesting is, as an industry, we all have those. And but I think we see, we talked at the very beginning of how important this is, and the time is right. So I think there's a lot of brilliant minds, a lot of investment, and a lot of commitment to see this through.
Yeah, I echo those points. In my mind, it's sort of the 3 R's. So it's representation. AI is only going to be good and reliable to the degree that the underlying samples sort of address all of the populations. And, you have to remember that, certain health conditions will show differently in different ethnicities. For example, breast density will show differently in African American populations, Asian populations. So if the underlying algorithm isn't done properly, then we're doing a disservice to our patient population. I think regulatory, still kind of figuring this out as we become more sophisticated. Right now we're just assisting the physician, but to the degree that becomes more sophisticated and we're driving more insights driven and a little bit more autonomous, those are big questions that need to be answered. And then the third R is really around reimbursement. So, what's the value of these? Who's going to pay for it? And how do you negotiate how much value industry captures versus how much value the provider and payer capture for some of these unique things? So all of those conversations will sort of play out, but I think it will take time. Yeah. So you say big bang, but I do think that it will probably be more like a journey.
The 3 R's of AI, I love it. Taha, I know you're very passionate about this topic.
I echo all the above comments. A couple of things. We recently issued a study called Reimagine Health, which is a global survey, 7,000 plus patients and providers. While there's a sentiment of excitement around the globe around AI and how it's going to advance humanity and improve access to care and advanced diagnostic, whatnot, but there's a lot of skepticism around dealing with the black box. A lot of providers, if I don't understand how the decision was made, it's going to be a problem. And this is the biggest challenge with a lot of these models, especially today, is a lot of these models don't need a ton of data to train them. You just need to show a few examples and learn really quickly. Majority of them, when we talk about this new generation of machine learning, they're self-supervised. So it's on us to develop them responsibly, meaning that we need to validate the output by exposing them many environments, whether that's for diversity, whether that's for equity, whether that's for different kind of population mix altogether, but at the same time is break the black box and explain how decisions are being made. Those are the two top concerns today. While we'd like to see advancement in this technology move us forward. In the meantime, a lot of the work is going to be around operation efficiency, around image quality, enhancement of workflows, because those are a lot less tolerant for error, for example, versus like you made a clinical decision at the point of care, and imagine now you don't understand how that decision was made altogether. I'm chairing a new board by AdvaMed starting this year with the digital health tech. Would have representations from regulatory agencies, big tech, med tech, startups, and the likes. It's really great to have this dialogue, and big components of that is robotics, AI, cybersecurity, especially with a lot of the information now needs to come to the cloud, as well as responsible AI.
Thank you. Great points. I guess one item that we often get asked about, and I'd love to hear your thoughts on it, is talent and workforce. I mean, we're talking about a very specific skill set in applying AI within the context of devices and diagnostics. Is that intersection of expertise available at scale? How are you thinking about this problem?
Yeah, it's a challenge. Anybody who has those skills in the audience, please connect with me after. No, it's absolutely a limited amount, because I also think that we're going through a journey of learning, what's necessary throughout this whole process, and especially for us located in Seattle, we're competing against a few other companies that are also working on other kinds of AI, not healthcare, but and similar resources. So it's always going to be a challenge.
They're doing some healthcare too.
I'm sorry?
They're doing a little bit of healthcare too.
Yeah,
Tahoe is helping.
Absolutely. So but I think I think going back to how we're going to get through this, it's going to have to be a combination of make, buy, and leveraging the resources that are out there.
So I know we talked about this in the New England context a few weeks ago. Any thoughts here?
Yeah, no, I echo those same points. I think, we've seen even just historically as we move to more digitization of all of our technologies and interconnectedness, these skill sets are incredibly important to incorporate in terms of both product development, in terms of R&D, as well as marketing, to be able to bring these technologies to market. There's going to be a little bit of a competition, I think, for talent. Because remember, this trend for AI is applying to consumer products, it's applying to all automotive products, all sorts of different industries. So, we need to kind of elevate this topic as sort of a destination for talent, given the tremendous opportunity that we have.
And I could the same. I mean, it's really just about being smart about where to partner, what to build, and where to buy. And still make the material investment. I mean, for us, we're making material investment in building large foundation models, because today those do not exist in healthcare. I mean, you have things that are being trained on Wikipedia and imaging and the internet, whatnot. Those don't necessarily work in our world. I mean, you have to fine tune them and also you don't know what the data that went in them in the first place and how biased they are. So this is something that we're making that long-term investment, so that way we can build them for the next generation. And also the abstraction of a lot of this. I mean, you're not going to find talents in large models. I mean, those are very few. This year, the U.S. only graduated 160 PhDs in machine learning. So you're not going to be able to find, and where those 160 are already going. So also investment in upskilling the rest of the workforce, abstracting at the right level, so data scientists now can and business developers can actually take and be able to bring this to the next generation, including in our customer space, where doctors can now interact with our models through an abstraction layer, almost like a Google map. so that way they will be able to kind of train and fine tune for their own purpose, whether that's intelligent protocoling, a workflow, or image quality, or even a chatbot.
Thank you. Well, really interesting discussion. I appreciate all of the thoughts you shared. I know we're out of time. I'm sure folks have questions. They can reach out to you offline, but thank you for sharing your thoughts and your time.
Thank you so
Thank
much.
you, everyone.
Thank you.